just wanted to say that I see the other side of the story. When he returns home and says, honey, I would like to have sex tonight. And she said, are you going to wear that thing? It's difficult because very often we forget to ask the partner. We know we have a society where men are very focused on that the solution to many emotional problems is to have an erection and to have intercourse. And many relationships are a problem because of the interaction in the relationship. So I'm here to balance off the medical aspect. I am talking about the sex therapy. Now, I trained with Masters and Johnson 30 years ago. I came to Roosevelt in 1979. And I'm telling you that because I am now one of the elderly. So I'm no longer going to talk about them, I'm going to talk about us. And it's important to know, as a sex therapist, where there are the psychological aspects of sexual dysfunction. We don't know what the medical portion is and where the psychological portion takes over. And therefore, it's important that we as professionals remember not to make a too hasty judgment. I remember sitting here in the clinic with one of the residents going to have an interview with a patient, and there were 2 charts this thick. And the resident said, there are 5 reasons why there's a physiological impotence in this, for this man not to function. And he said, why are we here? I said, because you have to ask the questions. And he arrives with this angry, not very good-looking wife. And as we go along, he just keeps saying, it doesn't work, it doesn't work, it doesn't work. And she's furious. And I said, well, I'd like to see you separately. And I saw them both separately. And it turned out that he masturbated on a regular basis. He had 2 mistresses, which one he had had intercourse with the week before. And he couldn't say that in the presence of his wife, and his wife had been with him at every interview. So this is why we need to ask the questions, and we need to be very careful. But I have learned through the years that sexual dysfunction comes in personalities. A man, for instance, who has psychological reasons for impotence is usually a person who also has difficulty expressing his feelings, and especially anger. And one of the issues we work with is to have him set boundaries in the relationship. Very important. A man who has premature ejaculation is very often a person who walks fast, talks fast, is never in process and always at the end point. One of my first exercises is to have him walk home slowly and watch the flowers. It's important to know that if you have so much anxiety that it's difficult to feel the presence, it's important to learn how to do that. The other exercises I give is learning how to masturbate, for instance, and reach an excitement level and stop. Let it go and start again. That's true for somebody who has difficulty with impotence too. What's the biggest fear? Is losing erections. Okay, now we're going to practice losing erections. And when you do that quite a few times during the week, you're going to feel less fearful of losing erections. So these are exercises that you can do, but the exercises aren't important. It's what they do to you that is the aspect of this. Women who've never had an orgasm to adult age is usually the oldest child, the high achiever. Out of 275 women, I found two that had less than a B average when they graduated high school. Now, what does that tell us about this woman? That she's very good at pleasing somebody outside herself. Women look at their body every day as if it was a piece of art, and learn to come to peace with not looking at the way it used to be, or the way the wrinkles are, or the way I've gotten fat here, and so forth, but really learning to love your body. I remember this woman who was in one of my workshops, and she said, you know, when I finally learned to love my body, I had already lost it. We have to know what's there and cope with what is there. And if you don't like your body nude, it's like going to a party in a dress you don't like. And all the women in the room will know what that's about. So it's difficult because our society says we need to be skinny, we need to be this way, we need to be young. And maybe, as an older woman, I will ask for a movement forward where we can like older women and older men in their bodies. I think that's important too. And some work need to be done, and questions to ask around that. Plastic surgery, of course, is extremely popular in order to stay young, but it gets very costly after a while. I think I'm going to leave it off here, and I'm going to let whoever has any questions in the question answer period to come to this. Okay, thank you.
Thank you very much, Dr. O'Connor, for what I think all of us will agree was a very thought-provoking discussion, and I think there'll be questions in the question and answer period.
Have an orgasm without following ejaculation, and it would frighten him, and he may be rushing to your office and asking that question. And so just wanted to say that.
That's true. It's important when you hand out Flomax or when you give Cardura or Hydrogen under the alpha blockers. It's definitely important to tell patients that, because they will show up to your office and they will call you and be concerned. Who would like to start?
My experience has been that anatomy is destiny, so that the same dysfunctions that we see in the heterosexual population are true in the homosexual population, the gay population, and whether it's women or men, and that the lack of erection in male couples becomes a problem, especially as men are more focused on intromission and less focused on mutual masturbation, while in women, women have more of a tendency of satisfying with each other without any focus on the orgasm as much, or the erection, the arousal. But it's pretty much the same thing. When I started as a sex therapist, I didn't think that I was qualified to deal with gay couples until one of the other sex therapists said, go ahead and try it. It's the same thing. It's just that you get two women together or two men together. And I think we need to understand that.
I agree. I think it's the same thing. I think I have patients who present with their partners to the office.